But today we're talking about one of my favorite topics, which is really something that we all um, struggle with on a daily basis, which is how do we keep our schedules filled and how do we buy back some time with getting, less time that we're spending on mundane tasks like insurance verification or claim submission or those denial letters. And how are we able to get our payments back to us faster? So we're going to walk through quite a few tips and tricks today. I am Sheela Roth, Head of Education at Pearl and an ADOM member. So I'm excited to be here and managed an office for about 25 years. So I'm also joined by Colin. I'm very excited to have you today, Colin, who's one of our main leaders here at Pearl over our sales team. Colin, share a little bit about your background with us so we can dive in.
Yeah, I'm a dental nerd. I really love the dental space. It's a weird passion of mine, and so when I meet other dentists, it's fun to be able to talk with them and nerd out with them, even though I'm not officially a part of the club. Been in the dental space for about 7 years. Had some experience through interactions with dental intelligence, with Weave. Know a lot of the other, platforms and programs associated with dental, and just a fun passion of mine that keeps me going and helps me take care of my family.
I love that. And what I think is going to be fun to hear from you today is really what teams are saying with some of the struggles that you're witnessing through, just meeting all these clients, whether you're at a show or talking to clients on a demo. Our team does a really good job at kind of meeting you where you're at, finding out what those pain points are and how Pearl or any AI can help your practice. So let's jump in. And again, please feel free to ask any questions. Happy to do that throughout the call here. All right. So today, while we're together, we're going to talk about smart scheduling, filling our schedules, enhancing case acceptance, because really, when we think about it, we have more patients saying yes in the chair, our schedules are full. And then also, how do we start using this buzz term, AI, right? This virtual team member in our practice. We hear about AI all the time, and it's becoming a standard word in our daily vocabulary, but we're going to really kind of dive in a little bit about what is AI and how can we use it in the dental space? So let's talk about smart scheduling. We did a lot of research recently and found that scheduling is really kind of top of mind for all office managers, probably all dental professionals. So 75% of practice managers said that making sure their schedules are full and align with production is a top challenge. And I just want to take a moment and say to how amazing office managers are because this is such a challenging job. When you think about keeping a schedule filled, no matter how great you are, humans are going to cancel. Humans are going to reschedule. Humans are going to no-show. And it's really, whether you're increasing your confirmations or calling personally or texting or sending, an Uber to them. I don't recommend that. But whatever you're doing, we still have this challenge on how do we keep our schedules filled. But this statistic was surprising to me because it's really telling about how this is all of us rowing in the same direction. And I think we are better together when we have more solutions. So again, all of our time should not be spent on the phone and insurance companies, and we'll dive into that in a little bit. But at the same time, some of these statistics are quite interesting when we think about the basis behind scheduling and AI is how can we think about keeping our schedules filled even when we're sleeping? And so what I mean by that is look at this statistic, 20 to 25 to 40% of new patients are scheduling appointments online. And I remember when I was working in my practice, we used to have a little column where they would pop up and they would turn orange if they scheduled online. And I always thought that was the greatest thing, right? Because you have a new patient, you're not sure where they came from, but they're coming today. Or you have a broken tooth and you're able to serve those patients. And that's exciting for us. Sometimes it's challenging when we're like, oh, we didn't know that patient was coming. But this is interesting when you think about 40% of new patients are scheduling online. So the first takeaway today is, do you have an online scheduling system that you're able to use? Now, don't worry. When I first started mine, I was worried that it was going to have, an excess of patients and I wasn't going to be able to see them. And I wish that was the problem. But you maybe get 1 to 2 a day. And typically you're able to accommodate those patients. So I would consider looking into something where you can customize that. You can block off certain times. There's certain times where doctors are available or maybe hygienists or assistants, and you can open up a single column. So that was really something that we learned early on and have benefited from. Again, literally showing up at 7 a.m. and we have a patient there for an assistant to see with a broken tooth, and that does turn into production. But more importantly, we're that dentist that's available to that person that was searching. So we're going to see throughout this conversation today how really convenience is taking over the dental space, right? We can order a coffee, guys, all of us, and it'll be here before this webinar is over. So we want to make sure that places like dental practices, which, no offense, are not the most fun to go to, are available when our patients want them to be. So, and we continue to look at the millennials and the Gen Zs. They prefer to book online and after hours. So they're scrolling through phones and they're like, get that message that you're sending out. Oh, you do for a cleaning? Definitely time to book now and be able to schedule at their convenience from their own living room. And why is this important? Because they're picking a time that's most ideal for them. So they're more likely to show up. And that's something we'll talk about as well. We need to be mindful of scheduling productively and scheduling, so that we are having the right time for the doctor, having the right time for the hygienist. But a lot of times we will push patients into areas that maybe they don't want to show up, right? So being mindful about when you are scheduling, what's the best day and time for you to come back to the office where you're not going to cancel? I'm kidding, but that would be a great question if you could ask that, right? Because that's really what you want to know. And I know for me, the first half of my hygiene life, I was like, okay, Colin, you're here today at 3. I'm going to put you in 6 months at 3. And he's like, well, I was off today. How about 6 months at 6 next time? I said, oh, okay. So I had to start learning that really convenience and consumerism is something that dentistry needs to be mindful of. So again, back to the amount of online bookings after hours, almost 70%. So I cannot stress that enough. Very important for you to have additional features in your practice that are going to assist you. And keep in mind, you have full control. Okay. So this is not AI taking over your practice, but these are solutions that'll work with you and for you. Chatbots. So we don't want to have robots answering our phones, but we see things like, Weave, who does a great job when you miss a phone call and they say, hey, they text you, we'll be right with you. Feel free to text us if you have an emergency, or we will call you within 24 hours. That's a wonderful thing to do, right? And again, imagine I saw a sample the other day about a robot answering the phone, and it was actually going through, how long has this tooth been bothering you? Is it on the upper right or the lower right? Is it waking you up at night? And I was really impressed. I still have some hesitation because I'm all about the human relationship, and we still feel frustrated sometimes, right? When we are on the phone and we're like, human, I need a human. So, but while we're moving through here, what are some things we can count on with AI to make our day easier and our schedules full?
Can I
So,
interject one thing here?
yes, please.
One thing just to touch on, because I am that modern millennial, like we are going to take the path of least resistance. And you want to have your practice set up in a way that you can have that human interaction when they walk in the door. But outside of that, it's easy, it's seamless. Otherwise, they're going to go somewhere else. And so it's not saying to modernize and update and revamp everything, but for that schedule, for that accessibility after hours and outside of when you want to be in the office, help your office be accessible during that as well.
Absolutely. And it's, to your point, Colin, if somebody doesn't answer the phone or if they can't get you in, you're calling the next dentist, right?
I did the same thing. I was out of town. I was working at Weave at the time, so I knew they had texting and a mobile app. And so I texted doctors at 6 p.m. at their dental office. And whoever responded with either an automated or somebody, that's who I went to. And it was me finding a new office because I had a toothache.
Yes, that's such a great testimonial because it is true. We have no idea. As consumers, we don't know who are great dentists and who are not. And we all on this call are great offices, right? You're spending time here, you're getting educated, you're trying to make the best of your time by learning. And we want to open that up to introduce more times for our patients. So I
And if
love your story, Colin.
and one more thing on that, this is not to say you need to be open 24/7 and, every single day. That is not what we want or what we're pushing for, but you want to make sure that those times that are available are productive, that they show up, they're educated, and they want to be there.
Absolutely. Okay, so we do think that AI is coming to get us and take over. And on a serious note, there are a lot of jobs that we may not need in the near future. But the good news here is that we will always need humans to think and program AI. So this is not really the AI we're talking about. It's simple things, computer systems that'll do things we teach it to do, right? And we've all experienced it. A couple of things to think about are automatic confirmations, automatic chart audits, and automatic insurance verification, right? And those of you, excuse me, that are on this call have already used some form of AI probably today, whether, sorry about that, excuse me, whether that's computer vision where you pick up your phone, right, and it recognizes your face, where you say, hey, Siri, and your phone will answer. And also think about any kind of warnings that you've received in the last maybe 6 months about fraud on your phone, or did you use navigation to get somewhere? So these are simple things that we're using on a daily basis that have come from these AI models, right? But it is important to remember any AI system, online scheduling, insurance verification, you have full control. And the same for doctors when we're talking about AI diagnostics. This is not to replace a doctor. This is to enhance the diagnosis. Colin, do you want to add anything to that?
Yeah, I actually have a very unique story with that. This isn't a flex by any means, but I had purchased a Tesla in the last 6 or 8 months, and it has AI all throughout where it will automatically drive. And it's so crazy how at times I have the full self-driving and I'm like, I need to merge because I'm going off this exit, and I reach to turn the blinker on and it does it for me. And it's right there with me a lot of the time. But there's also times where I'm like, oh shoot, I gotta take over. What are we doing? And I'll call it just like you stupid car or something, because I'm still in control, but it's so convenient and so nice. And that's how AI needs to be. We are, myself included, and I'm a nerd. I'm afraid of it at times too, but there's so many times where we hesitate to adopt something that really can improve, streamline, and make things so much more efficient.
Yeah, I have the self-driving on my car. It's not a Tesla, but I haven't even tried it because I'm still scared. So I might have to talk to you about.
It's a little better than that horse we can see over here on YouTube.
All right. So again, why are we thinking about AI from a dental perspective? And I want to encourage you today as we get through how to submit claim denials in 2 seconds to really kind of open your mind about AI doesn't have to sleep, right? It doesn't have to worry about how it feels every day. It's a consistent operating system in the background on a daily basis. So there's a lot of chart audits, again, like I was saying earlier, and a lot of additional things it can do for you so that you have more time with your patients. It's great at doing numbers, finding patterns, making recommendations. You all see it when you're watching, Netflix or you're ordering something from Amazon. It tricks me every time. It's like, but you need these socks too, right? And so I love it, and I sometimes am annoyed. I want to turn off the suggestions. It'd probably make my budget better. But again, it's not going to be good at empathy, judgment calls, and creativity, which is what all of you and all of us humans are good at because we have to be able to talk to patients. We have to help them understand, those conversations that you guys have about losing a tooth, right? That's a terrible conversation. And you can't just have a robot go in there and say, yes, you will have an implant. It'll be great. It's $5,000, right? That's a very, I mean, I don't know if you guys have all experienced this. You can put it in the chat, but most of us have had patients crying in the chair when you have this type of news. And the point here is when you're freed up from mundane tasks, you can be more present with your patients. So let's move into how is AI really helping schedules? I'm not sure if any of you have used some AI systems out there that allow you to hover over an opening and it'll suggest patients, right? It'll actually tell you you have an opening at 3 o'clock today, and you can send a message to 40 people for hygiene. Hey, Colin, we look forward to seeing you. We do have an opening at 3 o'clock today. Now, I've never used that because I'm always worried that what if 5 people answer? Um, Probably not happening, but it's a nice touch. And also in the future, you're going to see where you do hover over an appointment, maybe it's an hour and a half, and it'll start to know that this is Dr. Jones' patient who recently accepted dentistry, maybe recently canceled, and they need an hour and a half and they like Dr. Jones. So our daily life is going to improve with AI so that we can have less stress and more time for relationships. Colin, you want to add anything about scheduling there?
No, I think there can be some hesitation in an office, especially from an office manager or, somebody who's in charge of that, of being like, I don't want to adopt or grab something that can replace me.
Yes.
And I think, again, this needs to just be an adjunct, and that's how it needs to be positioned for your office or for your owner or for your spouse or whoever it is, that this is a tool, not a replacement. And even just now, while we've been on this call, I just asked ChatGPT what the limitations are. And there's a lot in here that we need office managers to be doing and schedulers to be doing.
Yeah, it's really we talk about how incredible dentists are and how many decisions they have to make in a moment, not to mention throughout the day, but then having an office manager focus on filling the schedule, but all the additional team members that they have, right? There's so much empathy that goes into being a manager and keeping just the day going from 8 to 5 that we have to look to other staff members to help us. And we have to think about in this shortage that we're dealing with now with dental professionals, how can we rely on some technology? Um, so again, to circle back to our keeping our schedules filled, there's nothing worse than showing up at 8 a.m., checking those text messages and those voicemails, and your day fell apart, right? Or you have 5 openings and you've got to fill that, which takes you a good 2 or 3 hours in the morning. And what we want to make sure you're aware of is that there are tools out there to help you. There's also ways to, and we're going to talk about that in a minute, but there's ways to streamline your regular day. So I know in the past when I used to be a hygienist, I would go to work and I would go about 20 minutes early and I'd look through all my charts. If Colin's coming in, I want to know, does he need x-rays? Is there outstanding treatment? Probably Colin. I think you might have cavities, right?
Mhm.
I'm just
Many,
kidding.
so many.
And then also, what x-rays are needed? Do I have to probe? And are there openings on my schedule with the doctor? If Colin has some fillings that we need to do, this day and age, that's a huge convenience to patients, right? So hygienists don't have to come to work and audit their charts anymore. When we started doing more same-day dentistry in my practice, which I was not a fan of because I'm terrified of the dentist, which is funny. But when I started asking my patients, they were over the moon. Wait, you can just finish the fillings while I'm here today? And I'm like, yeah, would that work for you? And I'd be like, do you really want to do that? But they would say yes most of the time. So how does this chart audit protect your schedule? When you look at tomorrow for openings, you can see all your hygiene patients with unscheduled dentistry. Maybe when you're confirming, you'd say, hey, Colin, I know you're coming in tomorrow. We're looking forward to seeing you. Doctor recommended a filling last time, and there is an opening after your cleaning. Would you like us to save you some time? Now, I know you guys are going through all your checks and balances, so I don't have to bring that up, but is the insurance verified? Is there a treatment plan? Is there the right amount of time? What's the medical history? All of that stuff. I know that you guys already have your checklist before you put somebody on the schedule. But wouldn't it be easier if your team showed up and every morning you just handed out this roadmap for the day so that everybody knew per provider what their job was when they needed x-rays, when they had unscheduled dentistry, and what they could really kind of talk to the doctor about when the patient shows up. So I think that's a real value add here, and it saves probably a good hour to an hour and a half per day.
I just talked to a doctor today, actually, this morning, who we were talking about production and production goals and bonuses for the team when they hit those goals. I said, well, so this year, how's it been? And he said, we probably hit 3 of our 6 months. And
Mm.
there's those days where you have your production goals, or you don't want it to be a goal like you're selling dentistry for it, but you do need to be productive as an office. But when there's that delta and gap, like what do? Do you scramble? Do you just mark it as a loss? You can use AI now to be that other set of eyes that's combing through x-rays for you without having to go waste human time we need to check somebody in and have that empathy and interaction.
Absolutely. And to your point, Colin, I remember when I think I told you the story, but when I would go into my practice on Saturdays, I would show up and I would look at the doctor's schedule and I would say, oh boy, there's an opening at 9 o'clock and 11 o'clock. And Saturdays for us, we didn't love working Saturdays, by the way, but they were the most productive day of the week because the interesting thing here, if you haven't tried Saturdays, is your patients objection is not the financial side, believe it or not. It's the convenience side. And it was like, okay, let me talk to you about a treatment plan, Colin. And he'd be like, as long as you can get me here on a Saturday and I have some insurance coverage, I'm not worried about the finances if I have to get it done. And so we'd come in, we'd look at the hygiene patients, and I would notice that there's an 8 o'clock opening on the doctor and there's an 8 o'clock hygiene patient because I'm looking at these schedules with a crown. And I would go into the patient and I would say, hey, Bob, Dr. Jones has an 8 o'clock opening. I know we talked about doing that crown. Would you like to start the crown now? We can bring you back for the cleaning because we have to put the crown on after the lab makes it anyway. And so, yes, the hygienist was open, but that $80 appointment just became $800. And I wouldn't have known that had I not looked at the chart audits. So Colin always hears me talking about these because these are like my favorite because it really is. If you're taking great care of the patient, we're not talking about overselling dentistry. We're talking about getting the whole team on the same page to really kind of troubleshoot those cancellations as they pop up. And this is a great way to do that. There are lots of systems out there, Next Health, Lighthouse, Dental Intel, so many that help you fill your schedules. And you also have those in your practice management systems. But I don't know about you guys, I don't have time to print lists out. And by the time I print them and check and go check again, and do they have an appointment? And do they have insurance left? And what's necessary for me to get these patients back in the door? And I had 6 providers, 6 doctors I was working with. So I had to really focus on how to keep all their schedules filled. So what I love is that there are systems, and one is in Pearl, where I can say, I need to fill Dr. Anderson 4 o'clock today for an hour and a half. I probably need a crown. And I can click crown, doctor, and the patients will pop up. Now, is that in your practice management system? Yes. But the nice thing about this, it's live. So automatically with the phone number, the insurance amount will be in there for you too with pre-check, and you'll be able to pull this list faster, and multiple people can work on this list at the same time. So I love that any minute I can go between filling my oral surgeon schedule, filling the crown schedule, the fillings, and I can fill it by provider. Colin, have you had teams on your calls struggling with this, or even any feedback you've had on teams really kind of finding other resources to help fill their schedules?
It's a huge burden for offices when they add that associate, or the doctor's stepping out, starting to retire, and they want to have a balance in that schedule, and not only just fill it with mundane, low production appointments, but now you can have a targeted list that's maybe they're a specialist or they just got back from an implant course. Let's go get their schedule full of implant, high production, great skill, and really helpful for the patient too. So having the ability to flip it to a production driven schedule or a production driven outreach really moves the needle, where you can focus and specialize it for a certain provider or certain column or op,
Mhm.
if that's what it is.
Yep, absolutely. And that is true. Back to that 75% of teams, right, that are focusing on this on a daily basis, right? We want to fill that schedule and also have tools to make this not so challenging. So really, when we think about filling the schedule, there's a higher success rate in closing cases with a live patient and getting them on the schedule versus sitting in the back calling patients all day long, right? And so what we want to do is make sure that the patients in the chair understand the dentistry that the doctor's recommending, whether that's a new patient, an existing patient, whether it's new treatment or existing treatment. It's the same approach, right? And when you come in the morning, you have those chart audits, you know which patients you're going to talk to. For us, when we were working with our hygienists, it was always, before the doctor came in, they needed to find out what, why, and where for the doctor. What needs to be done? Is it something on the schedule? I'm sorry, is it on the treatment plan? Or is it something new? Why does it need to be done? Is it bothering the patient or is there a cavity? And then really, where is this patient at? Meaning, you know, Dr. Penrod, Colin's here today. I've already talked to him about that feeling we've been keeping an eye on. He wants to wait till it breaks off. And so the reason I'm saying that he doesn't want to do anything is because I'm giving my doctor the where, right? Unfortunately, if the hygienists or even assistants are not helping with these transitional little kind of nuggets, I call them, then that doctor's responsible for going in and redoing that treatment plan every time with zero idea of how to approach the patient. So we really want to be mindful about um, heating up the patient correctly and giving the doctor the keys to success. It's the best thing if I recommend something and the doctor says, oh, Sheila's crazy. We can wait on that. There's just a couple cracks there, and she's worried. She's a little um, detailed, so we'll watch that. That's a win, right? That's a huge win. And so I know, Colin, you've had recent experiences with your own dentist appointment and stuff you shared with me. Do you have an experience that you kind of want to talk about with accepting dentistry?
Yeah, they're with my dentist, like the hygienist does a lot of the appointment. They do a lot of the legally they can't diagnose, but that pre-diagnosis, that pre-treatment, and even to the point where this was an office last week where the hygienist will essentially write the treatment plan and the doctor comes in and confirms it. And so when you have that continuity of, hey, yeah, I heard her say that the assistant hinted at something in the upper right, and it really transitions to, okay, this should be done. I understand it now. I'm going to do it, but also I'm going to show up because that millennial tummy ache is real. I get that a lot. And if you don't get it, you're not going to show up, whether it's a tire appointment, a dentist appointment, or an interview. It has to be understood for it to be accepted and shown up and completed.
It's true. And I'm sure, I mean, you have a lot of experience. Isn't your wife a dental assistant?
Yeah.
So you kind of have the insider information there, but still, and also in all fairness, you have Pearl, so you know dental x-rays, but isn't it still amazing when you go into an office and they're standing in front of the x-ray, like we've all done with black and white, and trying to explain things that only, radiologists know or clinicians that have taken radiology classes know. Um, and so I'm curious to hear if you have some feedback from practices that have been using AI for case acceptance and really kind of from a patient perspective.
It's difficult when you're looking at those shades of gray and you're like, this dark shade of gray is bad. This other dark shade of gray is just your nerve. That's the pulp. That's a good gray. And so when you're able to differentiate that, it doesn't become because I think a lot of people have, we're scared of the dentist or we're have a bad taste in our mouth or we're not quite sure. And he has a really nice car and he has that boat. And so there can be that misconception. And so if we can further drive that understanding and that clarity for the patient, they have that aha moment where it
Mhm.
goes, yeah, I need to do that. Even though it doesn't hurt, I understand it, so I'm going to do it. Not just, hey, well, we should do this or we're going to be doing a root canal. Well, it doesn't hurt. I had a patient, it was an interesting little side tangent. I was at an event. I had another vendor was there and he said, "Oh, my dentist has Pearl." I was like, "Oh, cool. How's it been?" He's like, "He pointed out a root canal that I needed because of an infection I had." He had no idea what he was talking about. He had a periapical radiolucency, massive. And he's like, "I didn't feel it. It didn't hurt, but he showed it to me in blue. And now I have a root canal that's recovering." And I was able to pull up his x-rays and show him post-op because they have a post-op x-ray, and he's like, yeah, it makes total sense why I should do that when I see it like that. And so that's a huge point too, is being able to just have them understand is very important because it's confusing.
It is confusing. And to your point, you said, the dentist is driving a Ferrari or whatever it may be. It's really an unfortunate negative connotation that we have um, as consumers towards dentists. And I think it also is important to really kind of talk about the lack of trust that still lives in the dental space, right? You see these statistics, and I just looked at one from 2024 from ADA, and they talked a lot about how there's still so much distrust in the dental space. A lot of this can be resolved when patients understand and there's some clarity. And 64% of patients say they don't understand their x-rays. To Colin's point, that dark nerve versus that incipient lesion, that's a hard conversation to have with a patient. So I do think that we're not saying that patients don't trust you personally, but what we're saying is some of them have bad experiences, and a lot of times they don't really see what you see, so it's hard for them to digest. When we're starting to really think about taking black and white to color, if you just walked in and this image was on the screen, you already have an entirely different experience with your patient. And for a couple reasons, I'm going to stay on this slide because the silver lining here that's kind of interesting. I don't know if I've shared this with you, Colin, but a lot of teams when I was training talked about I never thought I would get time back in my case presentation. And what I mean by that is I'm not spending so much time staring up at an image trying to explain anatomy before I present the concern. Because everything's color coded, patients recognize white teeth, they understand red. Now, when I present, I can still go through it faster, and I bought back time to listen to their questions. And I think that's the magic behind building the relationship, building the trust, increasing the case acceptance. And note here, we talk about production, but really the production improves if they just start with accepting what you're recommending or what you recommended last time, right? On average across the US, 50% case acceptance is what we're dealing with, and 25% for new patients. So imagine the conversation here when we look at this big red spot on tooth number 30. And we look at on the right side and we talk about how we're concerned that this cavity might be getting closer to the purple nerve. And if it does, you're going to probably need a root canal. Now, it doesn't hurt now, but we want to avoid that. So we can't put a small filling on there. We're going to need to put a crown on there. Now, you also see a lighter pink over here on the tooth in front of it. That's an area that's in between your tooth. It's starting to be a small cavity. We're going to keep an eye on that. In fact, we have a way to remineralize that if you're interested. And also this one on the top, that one is also getting a little bit closer. You can see it's red. It's passed through the next part of the tooth. And we're probably going to need to fill that after we finish the one on the bottom. Now, hygienists, if you're on the call, or office managers that you're talking to your hygiene team, we're going to put boxes around calculus. And you also see the interesting bone level measurements here. What we like to let you know here is that this is a very powerful tool for the patient because you are now bringing the diagnostic ability that we have as clinicians into something that's visually understanding for the patient. And for the front desk, those bone level measurements on these radiographs are going to be something we lean into in just a moment on how to increase your claims payments and decrease your denials. But this is kind of my favorite slide because it really shows so much about how AI can really bridge that gap between the clinician and the patient. Colin, what else would you like to add to that?
I think a big part with AI specifically is two main areas that I hear of offices using AI for their x-rays. It's one, it's explaining everything that your provider or you as a provider see. It's being able to translate and show that in color. And it's also there to ensure things aren't overlooked. Like on number 3, I see doctors tell me all the time, yeah, I probably would have missed that, or I wouldn't treatment plan that until they look a little further, until they get their eyes actually on it and they decide, yeah, we're definitely doing that. So being able to just add that extra level of full self-driving or that horse that's just cruising and we're still in control is so helpful in making the day more efficient.
Absolutely. So you take that case presentation to color. Now let's dive into interesting scenarios here about really removing some of that time you're spending daily calling those insurance companies and verifying everything, or even the blockage between, I want to do Invisalign in room 5, but I don't know if there's ortho coverage, or Is there coordination of benefits I have to call? There's a lot of these blockages that can be removed with AI verifying insurance before your patient arrives. And we're not going to talk about this world where you don't have to have an insurance person in your practice ever again. Back to that human part. Unfortunately, the insurance companies are not telling us everything we need, or dentistry would be a little different. But what we can do is talk about something that is really kind of important. And back to statistics, we can see how important this has been for office managers. So 73% of practice managers struggle with insurance-related complexities, whether they have the time to verify, whether the insurance is coming back correct. And really it comes down to, I wish I had an extra person. 39% said streamlining insurance verification was a top priority for 2025. For 2005, wow, hopefully we get to it before 2025. See that number? It's wrong. And then 35% said it was very time consuming. And I think if we took a poll, I'd love to hear from you guys while you're here. I'm sure all of you would agree that this is probably one of the areas that really needs the most help. When we talk about, the RCM challenges, really kind of three come to top of mind, which are claims denials, frustrating, take a lot of time. We can get ahead of those. Delays, same thing, they're right behind denials. And the repetitive tasks that we have to do, which is attach the image and send the narrative and send the probings and send the charting. And there's a lot that AI can do for your team when it comes to um, verifying your insurance ahead of time, checking not only like are they active or not, but are we able to actually get that breakdown for you? Does the insurance cover ortho? Do they do downgrades? Is there coordination of benefits, right? What happens if a new patient walks in your door and they haven't verified the insurance? Can we get that breakdown right away? And that's exciting for us because it really helps that full circle of the patient visit, and we can give the treatment estimate and cost while the patient's in the office, not having them walk out the door and letting them know we'll check your insurance and get back to you, right? I mean, think about any other industry in the world. You don't have anybody say, okay, I know you're interested in this. Let me go check and I'll call you in a few days, right? You can imagine buying a car and they're like, well, we'll check and let you know how much it's going to cost. I'll call you Thursday. So I don't think dentistry and buying cars are similar. But what I do think is not all of us want to buy dentistry. So if you let me go 3 days, I might be thinking, okay, I can do that, look at it again when I get my cleaning. So I do think that being able to bridge the gap is going to be a huge win for insurance verification. And I'm going to go through a few key points here in just a moment, but I want to make sure that you guys know with the images that we were showing earlier, there's a really excellent way to be able to export these or take screenshots and send these directly to your insurance company with your existing documentation. One more level of preventing you from denials. And again, that's how we're using our insurance verification and our second opinion feature to be able to make sure that not only is the patient verified before you get there, but then you can use the images as that second piece of documentation, especially for SRPs. When we can put on the radiograph within 30 seconds that bone level measurement from CEJ to bone crest, and we know anything above 1.5 is what they're looking for claims, that's a big win for your team. So, Colin, I'm going to let you chime in here in just a second, but I did want to walk through how Pearl's a little bit different for verification because it was really built by office managers for office managers. In fact, ADOM was really kind of responsible for leading us down this path and saying this is really a high demand for us. And if there's anything you can do in the dental space, it would be insurance verification. So we're thankful to you guys for really kind of making us push this to a higher priority. When we look at the way we have aggregated the information from the payers, it's built specifically for you to do a treatment plan. And what I mean by that is we know by now there's a lot of different insurance verification companies out there, but do they do the work with the office manager in mind? Right. So for example, we can see on this patient here, Lindsay, we see orthodontic coverage, we see sealant coverage, we see night guard coverage, right? So before Lindsay ever comes in, we're able to go through and notice I could do a night guard. This person can have sealants. This person can have orthodontics. And that is helpful because if you look at going to your portal, that's about 11 to 12 clicks, right? So that'd be fine if you only have 3 patients a day. But we also bring into specific history. So if you have the ability to, know, Colin, we've done that tooth last year. You have a cavity again. The insurance is not going to pay for it, unfortunately. So this will be full fee for you. That actually creates a lot more trust instead of, Colin, I have no idea if the insurance is going to cover this or not. It's going to be $0 or $300. Would you like to come in on Tuesday? So when you have more information, you can more confidently present the dentistry before the patient walks out the door, which leads to full schedules, right? So I'm going to stop sharing for a second, Colin, turn it over to you, and I'm going to do a quick exercise with you guys and show you this little fun trick we're going to walk through with our famous chat GPT. But Colin, I'm going to let you go ahead and chime in and share with us a little bit about what you have experienced with clients from the intake, which is what are they saying on those calls? And also what have you heard in the field about insurance verifications and the problems that teams are struggling with?
A big problem that I think, and I wish you would have prepped me more for this. Just kidding. This is off the cuff, just so everybody does know. I think a big problem offices run into is we can't do anything unless Sheila is in the office. We can't verify insurance unless so and so is here. We had one instance specifically where a girl said, "I haven't taken a vacation in 7 years because if I'm gone, we don't have insurance get verified." And so being able to just make that role a little more flexible. And she even mentioned specifically, she's like, I was afraid of AI for insurance because I didn't want it to replace me. And it's not that. It's such a useful tool. And I think every person who's ever been to a doctor's office or dental office, you leave and you pay that copay hoping that's all you're paying. And then you get that EOB or you get a bill and you're like, oh my gosh. And it's just sickening. And I think some people make a rash decision on that and change where they go, change who they're with. And so it's important to be able to use the up-to-date tools you have to provide that transparent and clear experience for your patients and for your teams.
Yeah, that's a really great point you made because most patients that leave your practice are because of financial inconsistencies. And I think that that's the number one way to have them not trust you. So if there's any of that, even that we've done incorrectly, the next time we recommend treatment, they have that memory in their mind, and that might make them hesitate if they actually return at all. So I do think, I remember back in the day, we would get these big stacks from our insurance team, like of all of the claim denials and having to write all the narratives. And my doctors would just be there going, oh my gosh, this is crazy. And then we moved into, all those wonderful templates and CDT codes where we would put in templates and we could get paid. And that's actually history now. They are not accepting those as often. And now I want to share with you kind of an interesting scenario here. And I learned this from Colleen Huff. And if you ever have heard of her, you should buy her book. It's wonderful. So I cannot take this idea as my own, but she was talking about how she's taking denials for specific situations like root planing with Delta Dental and having Chat GPT. And if none of you have tried that, I encourage you. Um, and really asking Chat GPT to help write a reply and include going and looking at the Delta Dental portal and figuring out some more information. So I want to show you guys what this looks like in real time, right? It's going to search the web and it's going to give us an answer. Of course, it's going to think about this more thoroughly, right? But now here is our letter. To whom it may concern, I'm submitting this letter. Here's the date. It even gave me, guys, the address of Delta Dental, and it's telling me exactly what to do here. It goes into all of the different codes, the different type of classification, why I submitted it, as well as how Delta Dental is supposed to be paying it. So this is just one scenario on how ChatGPT can help you with submitting claims and also thinking about basic things with ChatGPT, writing a letter to your patients for end of the year, a marketing campaign. How do I reply to this employee when I want to say something this way? Please make it sound nice, right? There's another scenario you can use there. But for this webinar, this is a really important takeaway because even if you know what you want to say and you put it in all crazy and you say, please make this professional and create a document to send to Delta Dental as a reply, it's going to save you so much time. So I hope that you guys see that as really kind of beneficial. Colin,
It's
thoughts
also
on that?
not a template. It's also not the, same exact thing you send every time where it could get flagged or get you in trouble. And so being able to iterate on those things and get something a little more creative, or maybe it's the fourth time it needs to be a little more aggressive. You can also do that. It's very customizable that way too.
Yeah, that's a good point. I've said this 10 times.
Yeah.
So we'll leave you with this. We know you all have to get back to your practice. And it's interesting when you think about this, what percentage of patients really understand dental insurance? And this is the reality here. They're completely confused, right? But yet, when we're presenting dentistry, we do kind of crazy things to them, right? We tell them these stories because we think, just like clinicians, those of us in the back do this, those of us in the front do this, we give them too much information, right? So it's another great way to use ChatGPT. How do I present this? Office managers are great at it, but maybe you're training someone. How do I present dentistry to a patient that has a big case? And here's the coverages. Now, this is not ChatGPT, but when we took our practice from the old way, which is too much information ahead of time, you have a maximum of 1,500 minus your deductible with 80% and the downgrade and all of this stuff, you've already lost them. We know 65% of patients have no idea what you're saying, but yet we operate according to those 2% that say, well, I thought it covered more, or I checked the website. That we want you to have all the information to be able to explain to them, but we don't have to present it that way. Colin, if I told you, hey, Colin, how was your visit today? And you said, great. And I said, did you have any questions about the treatment we're recommending? No. We showed it to you with the x-rays. I already know the insurance is verified. And I can let you know that, to fix that tooth, it's only going to be $800 after the estimated portion for your insurance. We're here 7 to 7 and Saturdays. What's best for you? So we moved into a one number treatment plan, and our case acceptance really changed overnight. So I think that what we'd like to do here is if anybody's interested, we'd love to invite you to schedule a demo. We'd love to talk with your team, your office managers, your doctors, anybody that might be interested in additional ways to help with AI for your case presentations or AI for your insurance verification, auditing those charts. Any way we can meet your team where you're at, discuss the challenges, and provide any solutions. We'd love to have you on a quick call and ask for Colin. I'm sure he'd love to talk to all of you. I will let you wrap us up, Colin, with last minute takeaways here.
Yeah, I think biggest things that mean for me, and I'm a student of AI, of dentistry, and I think the biggest thing to remember and take away is that AI is not scary. It's only as scary as we don't know. And I think the sooner we embrace it, the better we'll be. And that's not just from a clinical radiography aspect. I use AI every single day. Even this last week, I recorded a meeting I was in. It gave me a whole summary. I can ask questions for when I zoned out. There's so many different things that we can use AI for. And I think for, ADOM members specifically, like be the pioneer, be the guinea pig so that you can be the hero as well. And so see these things out, look into things, and you know embrace them as well, because there's a lot of good things that are coming and things are evolving. We're not dipping x-rays anymore, really. Maybe some of you still are if you are good, but like let's embrace the evolution, and let's make our practices run a little bit smoother, a little better, and more efficient.
Excellent. Well, thank you to all of you that joined us today. And Colin, thank you for taking time to join me. It was great having you. And we hope to
Thank you.
see all of you on a demo or also at the ADOM convention coming up in the fall. Have a wonderful day, and we'll see you soon.
Yeah.